A proper bite is important for the health of your jaw joint, the jaw bones, the teeth, and the muscles. This animation shows how in a proper bite the jaw joint is completely seated in a socket as depicted by the green lines lining up. When the jaw moves, the jaw rotates about that socket position, and during full opening comes out of socket. During closure, when you bite, the joint seats fully back in the socket as seen by the green lines lining up. Another important element of a good bite is called canine protection. In this animation, you'll notice how the canines instantly separate all the back teeth when moving sideways. Typically, jaw problems and tooth grinding occur at night when patients aren't aware of what they're doing. Another important element is the role of the front teeth. Notice in this animation how when the jaw moves forward, the front teeth contact, the back teeth instantly come apart, and when you close, notice how the jaw joint seats fully by the green lines lining up again as you go back into your proper bite. The muscles function in a very specific way when the bite is proper and the jaw joint seated fully in its socket. Notice in this animation, during opening, there's a muscle that's attached to the chin, goes somewhere down near the Adam's apple, and pulls the chin down as you start to open. During full opening, another set of muscles called pterygoids contract and pull the jaw joint out of socket. These are the only two muscles that should be functioning during opening. During closing, the large blue muscles are the closing muscles, and the large blue one around the side of the head is called the temporalis muscle, where this muscle is often a cause of headaches during nighttime clenching and grinding. In closure, notice how the big muscles take over, bring the jaw joint up to its position in the socket where the green lines line up, and the patient comes back into a full bite. The key understanding here is that the little blue muscles, the pterygoid muscles, are completely relaxed, and that's shown in this animation by becoming blue. Your dentist has determined that when you bite, when you're awake, the jaw joint is not fully seated as shown by the green lines not lining up. Although you can open and close and go back into a bite, notice how you habitually, when awake, bite where the teeth fit the best, but notice how the joint isn't fully seated. At nighttime, when you're not aware of where you're biting, you have the ability for the jaw joint to go to a different position as seen here by the green lines lining up. Notice in this animation how only the back teeth contact. This can cause damage to the back tooth, can cause premature crown failure, stress on the bones, and cause the muscles to work in a way that's hyperactive. This animation shows on the left normal muscle function, on the right what your muscles look like as determined by your dentist when you're sleeping and clenching. During full opening, everything looks the same. During closure, when you close, notice how on the right, not only the big closing muscles on the side of the head and the side of the jaw are contracting, but the little pterygoid muscles are contracting because they have to hold the jaw joint out of its proper position. This causes unnecessary stress and what we call hypermuscle activity, and can be a leading cause of headaches, especially in women. The treatment your dentist recommended is a very specific splint, or dental appliance that has all the elements of a proper bite. When placed in your mouth during sleeping, this splint, as you close on it, will allow your jaw muscles to do what they normally do for complete health and function. Notice how the jaw joint fully seats. The only muscles that are functioning are the muscles that close your mouth, and the small pterygoid muscles are relaxed. To give you another view of that, we'll back up and review how the muscles are in a hyperactive position, contracting in ways that are abnormal. The joint is not seated. The appliance allows you to close, and as you close and swallow on it, seat the jaw joint It has proper tooth contact, and it also has the elements of separating your front teeth if you move forward or sideways. Notice how if you slide forward on the splint, the front teeth touch, back teeth come apart. As you go back into your bite, the joint seats. The final element built into this dental appliance is canine guidance or canine protection. Notice how if you move sideways, only the canines touch and all back teeth come apart. Your dentist is trained to make very accurate impressions and understands the elements required for this dental splint. The splint has to have the provision to allow your jaw joint to seat, to separate the front teeth if you move forward and backward, and you will get protection on the teeth, protection of the bone, comfort in the jaw joint, and most importantly, the muscles will function in a normal fashion.